Stephen Sharfstein is president of the American Psychiatric Association, and Dr. Joseph Glenmullen is a professor of psychiatry at Harvard Medical School and author of the book, The Antidepressant Solution. Gentlemen, good morning. Nice to see you both.
Nice.
All right, lots to tackle here, and let me start with you, Dr. Sharfstein. Tom Cruise's statement, he says drugs are never the answer, basically, when it comes to psychological and behavioral problems. What do you make of what he had to say about this?
Well, yeah, Mr. Cruise may be a halfway decent actor, but when he starts to play doctor, he's being totally irresponsible. This is his statement crossed the line, especially when he took after Brooke Shields, who came forward and described a true, important medical psychiatric condition, postpartum depression, and her treatment for it, and said that she needed diet and exercise for that. That, I think, is a disservice not only to her, but to psychiatric patients across the country.
Dr. Glenmullen, you've written 2 books, I know, about antidepressants. What do you make of his assertion that they're dangerous and really should never be prescribed?
Well, I don't agree with everything that Tom said, and I'm a psychiatrist. I prescribe the drugs myself, but I think there's a middle ground here. I'm very much a moderate in the debate. And I think we don't want to lose sight of the fact that he did, in fact, raise some very important issues.
Like what? What do you think the most important?
Ritalin and Adderall are being used as street drugs.
But so are some painkillers, to be perfectly honest. Does that mean that painkillers shouldn't be prescribed?
But patients should be told. They should be told when they start these drugs. Psychiatric drugs can mask the real problems. Psychiatric drugs are being overprescribed. He's right when he actually says that there are no proven biochemical imbalances. Everyone's shocked by that, but it's true, and we don't want to lose sight of the very real issues that he's raised.
Well, let me talk to Dr. Sharfstein about that. What about, he said there's no such thing as a chemical imbalance. Tell us your reaction to that.
Well, that's total nonsense. It belies the last 20 years of incredible breakthroughs in neuroscience and our understanding of how the brain works, and the fact that the medications that we use are very helpful, often very helpful. I also take the middle ground. You know, obviously, often these medications are overprescribed, but also I think they're underprescribed because there are many people out there who have not come forward for treatment who could benefit from the medication.
I just have to, Dr. Glenmullen, ask you if you believe, if you agree with him, there's no such thing as a chemical brain imbalance.
Right.
Then why are you prescribing antidepressants?
Well, they clearly help. I've seen them help patients. There are studies that show they help.
Well, obviously, are they helping with brain chemistry?
We don't know that. It's never been proven. Do you know that the FDAs in other countries have actually banned pharmaceutical companies and doctors from making that claim? Because it's actually never been proven. So it's misleading to tell a patient, you have a biochemical imbalance. This drug is going to correct that imbalance. It's in TV ads. It's in magazine ads. It's said all the time in doctors' offices. That's why people, millions of people, are shocked by what Tom Cruise said. But that is actually true.
I disagree. And this is the kind of scientific debate that we are having within the field of psychiatry that's constructive. That's very different than Mr. Cruise's assertions, which I think are destructive.
What about the whole notion of vitamins and exercise? Does he have a point that there are alternatives to medication?
Absolutely. There's been an excellent study comparing, for example, the antidepressant Zoloft to exercise for mild to moderate depression. Same kind of studies that are used to study the drugs for approval for FDA, and exercise was as good as Zoloft head-to-head in a study. Now, if you're severely depressed, you may not have the energy to exercise, but once you're feeling a little better, maybe on an antidepressant, exercise can be one of the best ways to help you wean off an antidepressant.
Let's talk about Ritalin and Adderall, because not only did he talk about antidepressants, he talked about medications that have been used for millions of kids for ADD and ADHD. And do you think that there's any useful purpose? Again, I think we can even state they're overprescribed perhaps. Maybe doctors turn to them too quickly. Having said that, do they have any value?
Oh, absolutely. Again, the middle ground is really the place to come on this. So there's no question that some children are so hyperactive that they really can't benefit from school. They can't take information in. But at the same time, it's also true that many children who get these drugs, it's because the classroom is too big and there aren't enough teachers and maybe the family situation is a little out of control and they need help and support and therapy maybe instead of the drugs. So again, we just need to strike a middle ground. You know, Katie, these are not black and white issues.
Right.
And it's very important not to try and limit them to black and white.
But just ask any parent of a child with attention deficit disorder, and they will tell you how important these medications are.
But also therapy is so important too. And when Tom Cruise says these medications sometimes mask the cause, too often doctors these days are doling out antidepressants or some things like Ritalin and Adderall and other drugs without the necessary counseling to kind of work with kids on issues that can't be cured with a pill, right?
Absolutely. And you know, people get very passionate about this. You know, if you took 100 people who went on an antidepressant and felt better, the science shows that 75 to 85 of them would have had the same thing happen on a sugar pill. If they were given a sugar pill and they didn't know it was a placebo. The placebo effect is very powerful. It's very persuasive. People really feel, wow, this really helped me. So, again, we need to just educate people so they can make truly informed choices.
And really have a more balanced view of this, but not necessarily throw the baby out with the bathwater.
No, absolutely. Again, a moderate position. They help many, many people, but they also are overprescribed. They have side effects that people aren't often told about. They have dangers that people aren't often told about. And there are, as you said, alternatives.
When you say dangers real quickly, what do you mean?
Well, for example, with antidepressants, we now have a warning that they can make people suicidal. People gain 20, 30, 40 pounds of weight.
And very
people
quickly.
Have severe withdrawal.
We're almost out of time. I'm so